Give me one confident answer. There are two answers in this. Which is not a boundary of femoral ring? Who will give me the correct answer? Not a boundary of femoral ring. Two options, you need to give me the answer. A and C, Shiva says. Kiran proposes only B. Tirupati says C and E. Manavi says only D. Which of the following does not form the boundary of femoral ring? One confident answer. A and C, okay? Alright. A and C is correct. Femoral artery and nerve doesn't form, but the vein, lacunar ligament, inguinal ligament, they form the boundaries, is what need to be remembered. After MI, at around first week, there is a risk of developing myocardial rupture. Austin Flint is when there is a severe aortic regurgitation. That regurgitant jet will be falling down when the atrial blood is filling the ventricle. So the forward flow of the atrial blood into the ventricle at the time of ventricular diastole is impeded by the backward flow of the aortic regurgitation jet, and that will create resistance to the atrial forward flow, just like in mitral stenosis. So it also leads to mid-diastolic murmur. Okay, so it is Austin Flint murmur can be confused for mitral stenosis ka mid-diastolic murmur. How do you differentiate? MDM of MS will show pre-systolic accentuation. Lubdub, it will say. Just at the end there is an accentuation. Right? But that won't be there in mid-diastolic murmur of aortic regurgitation. Loud S1 is a feature of MDM associated with MS. Loud S1 is not a feature of Austin Flint of AR. That's what need to be remembered. Anyway, if we have some good pictures, everything, it is easy to review that, murmurs. Okay. Large A waves, Canon A waves, where do you come across? Large A waves means there is an increased A wave. What is the A wave due to? Contraction of the atria at the end of the ventricular diastole, towards the last 1/3 of the ventricular diastole. So any ventricular hypertrophy, pulmonic stenosis, tricuspid stenosis, that makes atria to contract with more force to push the blood into the ventricle during the last 1/3 of the ventricular diastole, that create large A wave. And Canon A waves will be there when there is a 3rd degree heart block. Why? If there is a 3rd degree heart block, when the atria are contracting during the last 1/3 of the ventricular diastole, AV valves abnormally close. So atria is contracting against whom? A closed tricuspid valve, and that lead to Canon A waves in the 3rd degree heart block is what need to be basically remembered. If you give nitroglycerin, you can terminate acute angina. But if you give nitroglycerin, you can worsen the acute angina caused by. If you give nitroglycerin, you can worsen if the angina is caused by. Many times we discussed. Huh? It should come as a reflex answer. Otherwise, you are not in the classroom of Dr. Murali Bharadwaj, MD in general medicine, he has to resign. Let me see who among our online students will give the answer. If you give nitroglycerin, yes, that's right, that's right. If you give nitroglycerin, what will happen, doctor? Varun also gives the wrong answer of aortic stenosis. In which condition giving nitroglycerin worsen the angina? Prince Medal Tirupati, no doctor, standard question. If you give nitroglycerin, it what will it do? Venodilatation. What will it do? Venodilatation will cause, it will reduce the preload to the heart. Heart का chamber size क्या हो जाएगा? छोटा हो जाएगा. छोटा हो गए तो a nuclear family will have more arguments than joint family. Remember, joint family arguments are all well managed and well moderated by the head of the family. Nuclear family, one father, one mother, one child kind of a scenario, there will be more bigger fights. So smaller chamber size, what will happen? Interventricular septum and mitral valve will come more closer, and that will cause more impedance to the LV outflow and leading to worsening of angina. So if the angina is due to HOCM, it gets worsened if you give nitroglycerin. Any other angina relieves if you give nitroglycerin. That's good. Dr. Shankar, Raju, Varun correctly says it is HOCM. No problem. Carotid sinus massage, SVT relieves. And if you do both sides carotid sinus massage, patient relieves. Then what is a very common arrhythmia, doctor? Most commonly, holiday heart, atrial fibrillation is most common. Pacemaker indications, doctor, favorite question of the examiner. Which Mobitz type of second degree heart block you want to give pacemaker? So remember, tachybrady syndrome, sixth sinus syndrome, third degree heart block, or prolonged QT, or acute MI, and if there is no Wenckebach phenomena and second degree heart block occur, what is that called as? Mobitz type 1 or type 2? Huh? Type 2 or type 1? One में Wenckebach होगा. What is Wenckebach phenomena? PR prolongs, 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 and then drops. There is some time. But type 2 में suddenly drops. There is an indication for pacemaker is what need to be remembered. Now, what is an indication for stenting? Aortic stenting. If there is a dissection of an aneurysm of the aorta, then that becomes a indication. If you do stenting, there can be a thrombosis of that stent, which is the main problem. If you want to know the MI, it is the cardiac specific troponin is the very, very specific marker. That's the reason what will you do? Anybody comes with chest pain to the hospital, you do trop test. Troponin T is the one. Remember doctor, 627 high yield topics may MI. Everything about MI you must know. ECG of MI, thrombolysis of MI, differential diagnosis of MI, types of angina, everything like a parrot you must be ready. So tomorrow, day after tomorrow, 2 days, 2 into 3, 6 hours marathon may we finish a cardiology review. Now, where do you find split first heart sound, doctor? Split first heart sound. First or second it should be. Second normally only splits. I think this question is yeah, right bundle branch block may there is a split of the first heart sound. Fundamentally, mitral valve and tricuspid valve close same time. Anything that delays the either first or second can lead to development of a split, like a bundle branch block, commonly due to the right bundle branch block. Now 20-year-old with non-exertional chest pain with non-ejection clicks which are multiple. Clicks ka matlab, which valvular heart disease you remember? MVP is what you will remember, and echocardiography is the way by which you can be able to identify MVP with MR, MVP without MR, everything. Now doctor, Austin Flint is a diastolic murmur, mid-diastolic murmur, just like MS, and you don't find Austin Flint unless aortic regurgitation is severe. Mild, moderate में Austin Flint नहीं होगा. It's one of the important markers of severity of the aortic regurgitation. Dyspnea and palpitations on examination, once more I think a repeat question. Okay. Okay, doctor, give me one confident answer. What is the length of fallopian tube? 25 is an answer we get. 15, 10 is another answer. Okay, doctor, interesting question. Pakad gaya. 10, Tirupati 10, RMC 10, you are shortening almost 50% of the naturally occurring fallopian tube. Other organizations will be filing a suit on you, doctor. Be very sure. Shravya proposes 25. You also said 25, nobody said 45. You must differentiate between ureter, spinal cord and fallopian tube. 8 to 10 centimeters. Correct? Karnool, Anuja, everybody right, but Shravya only lengthened it to 25 centimeters. So very long, it need to be properly scaled. And if any confusion in this matter is there, tubectomy become upar niche. So anyway, just to tease you before exam, so you need to be sure, doctor. Austin Flint is mid-diastolic murmur. Dyspnea at rest means NEHA classification, grade 4. Then catatonia, schizophrenia. Delusion is thought disorder, thinking. Then in schizophrenia, undifferentiated type is the most common type. Hebephrenic has worst prognosis. Worst prognosis. Anybody answered simple or paranoid? You answered. Paranoid frequencies are little confusing, doctor, always. I remember it as undifferentiated. I just need to recheck that. Now, if you give haloperidol or any conventional antipsychotics, if the schizophrenia is resistant, you give atypical antipsychotics, especially for negative symptoms. So, clozapine is the one which you typically Anuja also proposes paranoid. We will recheck about paranoid. I still provisionally think undifferentiated. Clozapine has got a great advantage. Psoriasis, silver pox, butterfly rash, SLE, Auspitz sign, psoriasis,